I'm going to talk to you about improving access to contraception in the Pacific, why and how. So we know why contraception is important, because the ability to decide the spacing and timing of children changes women's lives and is a fundamental human right. It's also one of the most cost-effective interventions that you can do in many settings, and I'll go into that a little bit more in detail later. So the objectives of my talk today will be to provide evidence that family planning is an unfinished agenda in the Pacific, and to present some recent research I've been involved in on unplanned pregnancy in the Solomon Islands, and also to suggest some future interventions. And it's in Papua New Guinea that Women's Plan Foundation has recently kindly agreed to support some research in contraception. The main message often from a number of international organisations is to try and integrate family planning into other services, such as antenatal care. So women turn up for their antenatal education and you speak to them about contraception at that time. This is from the Family Planning 2020 site, actually, to integrate family planning into immunisation programs. Or the area I'm most interested in is postpartum, immediate postpartum contraception. Because we know that more than 90% of postpartum women in developing countries really do want to space or limit the number of pregnancies, but 61% are not using a method. And they're there at the hospital, and often these women don't have a lot, if they particularly, a place like the Solomon Islands, women are dispersed living across islands, and it's very hard to get to health facilities. So this is an opportunity to access the health facility, access professionals with the skills to provide you with that method, and I don't think should be missed. So finally, why do we want to improve access to contraception? We've heard about the Millennium Development Goals. We now have the Sustainable Development Goals, and we want to increase access to family planning because actually it saves lives, it reduces poverty, it empowers women, allows them to go out into the workforce to get an education, it encourages environmental sustainability and huge economic benefits to the community as a whole. Thank you.